Hello, my name is Harshal. Welcome to Decode Healthcare with Harshal. This is set 2 for anesthesia questions. This is the video for the ones who are preparing for medical coding profession or the certification examination of CPC. However, nobody has told me to prepare it for some other chapter. So yeah, here we go for anesthesia set 2. As usual, you will have your questions on your screen. Please take 2 to 3 minutes or go up to 4 to 5. Get the best possible answer from the options given, and then I'll tell you the right answer. And that way, if you want to directly skip to the answer, why not go ahead with 2 to 3 minutes, and then you'll have your answer as well. All right, there you go. Here's your first question on your screen. What is the anesthesia code for an appendectomy? All right, your answer for anesthesia code for appendectomy is 00840. Why? Because 790 is for procedures on kidney, 840 is for appendectomy, and 860 is for lower intestine except rectum, and 862 is for lower intestinal endoscopic procedure. So that is why your answer is Bombay 840. All right, here we go. Your next question. Anesthesia code for laparoscopic cholecystectomy. All right, the right answer for laparoscopic cholecystectomy is what you'll do, you'll go to a procedure and see if there is something related to removal of gallbladder. So in anesthesia, locate gallbladder or cholecystectomy. The correct code for anesthesia for procedures on gallbladder and bile ducts, including laparoscopic cholecystectomy, is 00790. Now, why? Because 700 is for procedures on upper abdomen. 790 is, however, I've used 797 here in the options. 790 is for procedures on gallbladder and bile ducts. 840 is procedures on lower abdomen. 860 is procedures on perineum. So the correct anesthesia code for laparoscopic cholecystectomy is 790. All right, there you go. This is your next question. All right. The anesthesia code for complete removal of penis, including removal of both left and right inguinal and iliac lymph nodes, is, if you go to CPT index and C for anesthesia penis, which directs you to code range Z0932 00938. Review the codes in the numeric section to determine 936 fully describes the procedure and it is the correct code. So option C is right here for third question. All right, here we go for question number 4. Appropriate code for a patient who had a regional block anesthesia provided for carpal tunnel surgery. All right. The code for the patient who had regional block anesthesia provided for carpal tunnel surgery is what you'll do. You'll go in anesthesia coding related to regional block anesthesia for carpal tunnel surgery. We'll look at the CPT codes associated with specific regional nerve blocks. Now, the four options were 20526, which is for injection, therapeutic, carpal tunnel, typically for injection, not anesthesia. 400 is for anesthesia for procedures on the forearm, wrist, hand, and fingers. This is a general anesthesia code covering more extensive anesthesia procedures. 1820 is for anesthesia for surgery on forearm, wrist, and hand, especially specifically for regional block anesthesia, and 1810 is for anesthesia or for upper arm surgery. Here, it might be too proximal compared to carpal tunnel, which affects the wrist hand area. So the right answer here is 1820 because it corresponds to anesthesia for surgery on the forearm, wrist, and hand, which includes carpal tunnel surgery and represents a regional block anesthesia in this area. The other codes do not accurately represent regional block anesthesia specific to this surgery. All right, here we go. This is your fifth question. All right. The answer for anesthesia code, which is assigned for obstetric patient who had a neuraxial labor analgesia provided by the anesthesiologist. When a delivery was expected to be a normal vaginal delivery, but the obstetrician performed a cesarean delivery when the fetal heart rate dropped. So, so the explanation is 1967 CPT code is for neuraxia labor analgesia for planned vaginal delivery. 1968 is an add-on code, which is for anesthesia for cesarean delivery for loving neuraxia labor analgesia. So if a patient receives neuraxia analgesia for labor and then requires a cesarean section, so both code 67 and 68 are reported. The other option of A, that is 62322, is for injection of diagnostic or therapeutic substances, not anesthesia, and is not appropriate here. So step by step in the book, what you'll go is you'll look out for a code called neuraxia, liver analgesia, and anesthesia chapter under subsection obstetric, and then you'll also find a subsequent service such as cesarean delivery after labor analgesia, which will go towards 1968. So assign both these codes, and then you'll get your answer as D 1967 and 68. All right. Here is your question 5. What time is used to report the start of anesthesia time? Is it surgery start time? Is it entering the operating room? Is it during the pre-anesthesia assessment? Or is it when the anesthesiologist begins to prepare the patient for anesthesia? You can come across this answer right on the anesthesia guidelines. Please do check, and then you'll have your answer here as well. So the right answer for what is used to report the start of anesthesia time is option D. The start of anesthesia time is reported as the time when the anesthesiologist begins to prepare the patient for anesthesia. This includes activities such as placing monitors, starting IVs, and other preparations directly related to the administration of anesthesia. It does not refer to the time the patient enters the operating room. the surgery start time, or pre-anesthesia assessment. You can also refer to articles in the journals of American Society of Anesthesiologists. All right. Here is our next question. What is the anesthesia time for an insertion of penile prosthesis performed by a perineal approach? So the anesthesia code for insertion of penile prosthesis performed by a perineal approach is 938. Anesthesia procedures on male genitalia, including the open urethral procedures and insertion of penile prosthesis by perineal approach, the anesthesia code is 938. In CPT index, look for doses of anesthesia in the male genital area. Direct support range 932 and 938. It's important to accurately document the procedure performed, including the indication for replacement of penile prosthesis through an infectant field in the medical record to support the use of appropriate CPT codes and ensure accurate coding and billing. All right, here is the next question. A 42-year-old male was admitted to an ambulatory surgery center and began having complications in the OR after the induction of anesthesia. The surgeon immediately discontinued the planned surgery. If the insurance company requires a reported modifier, what modifier best describes the extenuating circumstances for the anesthesiologist? Your options are 53, 23, 73, and 74. All right, the explanation is modified. 23 is the right answer. It is used to report anesthesia services provided under unusual circumstances, like a complication after induction of anesthesia that forces termination of planned procedure. The other modifiers apply to surgical or procedural coding, not to the anesthesiologist service. That is 53 is discontinued surgical procedure, 73 is discontinued outpatient procedure prior to anesthesia, 74 is discontinued outpatient procedure after anesthesia. So modified 23 is the best captured here as it is the extenuating circumstances faced by the anesthesiologist in this scenario. All right, there you go. There is your ninth question. Anesthesia start time is reported as 7:14 a.m. in the morning and surgery begins at 7:26 a.m. in the morning. The surgery finished at 8:18 a.m. in the morning, and patient was turned over to PSCU at 8:29 a.m. in the morning, which was reported as the ending anesthesia time. What is the anesthesia time reported here? The options are A, B, C, D. A is for 64 minutes, B for 75 minutes, C for 52 minutes, and D for 63 minutes. All right. To determine the anesthesia time, I have given a step-by-step solution here. We need to calculate the duration from the start time to the end time. The anesthesia time starts at 7:14 and ends at 8:29 a.m. So what you'll do, you'll convert the start and end times into minutes. Since midnight, 7:14 a.m. is 7 into 60 plus 14, that is 434 minutes. And 8:29 a.m. is 8 into 60 plus 29, it is equals to 509 minutes. So subtract the start time from the end time to find the duration, 509 minutes minus 434 minutes, that is 75 minutes. So the anesthesia time reported is from 7:14 to 8:29, which is 75 minutes. So the correct answer is B, that is 7:14 to 8:29 a.m., that is 75 minutes. All right, here we go. Last question for us. A pre-anesthesia assessment was performed and signed at 10:21 a.m. Anesthesia start time is reported as 12:26 and surgery begins at 12:37. The surgery finished at 15:12 p.m., that is 3:12 p.m. in the afternoon, and patient was turned over to PSCU as 15:26, that is 3:26 in the afternoon, which was reported as the ending anesthesia time. What is the anesthesia time reported? There you go. This is the last question here. Also, let me know in the comments what do you feel about the questions. Is a 10 question video appropriate for you guys? Do you need more questions? or do you need me to focus on any particular chapter? Also, please like and share it to your friends as well. Also, I'll be very happy if you subscribe to this as well, this channel that is Decode Healthcare with Harshal. All right. So answer for this is to calculate anesthesia time. We need to find the difference between anesthesia start and end time. So the anesthesia start time is 12:26 p.m. and the end time is 15:26 p.m. That is 3:26. So the difference between these two times is 3 hours, and the anesthesia time reported is 3 hours. That is 180 minutes. So the correct answer here is B. That is 180 minutes. All right. Thank you everyone for watching this video. Please like, share, and subscribe, and do let me know in the comments what topic would you like to practice on for your exam, if you have a certification examination or for your working professionals. All right. Thank you again. My name is Harshal, and this is Decode Healthcare with Harshal. I'll see you